I'm Dr. Hilary Neve. I'm an NHS GP and I've also spent some periods working abroad. One of those places was northeast Kenya, where there was a very severe drought. People who lived there lost nearly everything. The bones of the cattle and the goats on which they depended were just strewn across the dry landscape. And it was heartbreaking to see people, particularly children, dying of dehydration, heat and lack of food. The United Nations say that unless we act urgently on the climate, within 25 years, drought could affect 3/4 of our population. That would cause widespread water shortages, crop failure, and severe hunger. When the people you love, or the lives of the people that you love, are at risk, just as I saw in Kenya, sometimes you have no choice but to leave your home to seek safety. Last year in Pakistan, 8 million people, that's nearly the population of London, had to leave their homes because of floods. And nobody wants to be a refugee. You aren't wanted and you're likely to experience danger and severe trauma. I've worked with refugees with broken arms because of police beatings, severe infections, and terrible frostbite from crossing mountains, freezing mountains, without proper shoes. And these are people just like you and me. There is hope. Climate scientists tell us that if we act now, we can prevent the very worst of this. But we have to act now, and we have to stop producing new fossil fuels. I think it's really important that the Science Museum teaches us all about the climate emergency. But I think it's totally wrong that they are accepting sponsorship from fossil fuel companies, BP, Adani and Equinor, who knowingly are driving the climate crisis and causing such terrible harm to our beautiful world and the people and creatures who live on it. Thank you. And just to remind you, please do go outside and talk to the health professionals outside, and please sign our poll and add your views when you go out. Thank you.